Hello, my name is Lorna Montgomery and I'm a senior lecturer at Queen's University in Belfast. Thank you for the invitation to share some details of a project that myself and my colleagues have been involved in as part of your seminar series. The project was called Getting Our Voices Heard, and really for the next half an hour, myself and my colleague Leslie Ann Newton are going to be talking you through the actual aims of the project, a little bit about what we did, a little bit about our findings, and then ask you to think about just how you might apply these to your own practice. Before I start that, I just want to acknowledge that our partner in Wales, we worked very closely with Wayne Crocker and Shan Davies, who were really very helpful in helping us to engage with our Welsh colleagues and to carry out some data gathering in Wales and some dissemination. So we're very grateful for the help that they offered. So I'm handing over to Leslie Ann now.
Hi there, so my name is Leslie Ann Newton. I'm the Director at Association for ExChange Northern Ireland. ARC really exists to bring together stakeholders across the learning disability sector with a view of their collaboration to try and improve the lives of people with a learning disability. So I'll be talking you through the next few slides. The first thing to say is that obviously Lorna has informed you about our project Getting Our Voices Heard, which was funded by DRIL, Disability Research on Independent Living and Learning. This was an innovative 5-year UK-wide programme led by disabled people for disabled people and funded by the National Lottery Community Fund. Now, there were various different open calls for funding in 2017. But in September 2018, a particular call called Getting Our Voices Heard was announced, and we were the successful bidder, so we're delighted. The total budget available was 100 grand, and the criteria stated that the project must be complete within a year. So obviously the objectives of the project are on the screen, but I think some of the key points to highlight is that really co-production was at the heart of this funding. Now, ARC has groups of self-advocating adults with a learning disability called Telling It Like It Is, or TILI, of which there are over 70 individuals dotted across the north. The original idea for this proposal was actually identified by TILI due to their responding to Northern Ireland's consultation on safeguarding policy back in 2015. So I was able to take TILI's suggestion and begin conversations with Lorna at Queen's University. So as the proposal was developed, with TILI members were held to ensure that their involvement was in the development of the approach and the project plan. TILI were really keen to be part of the meaningful research process and welcomed therefore the opportunity to co-lead and having led on many peer consultations and using various different tools, including the likes of Talk and Mats, to ensure that the inclusion of their non-verbal peers. TILI welcomed the opportunity for the peer searcher role. And they also suggested making the connection with another peer advocacy network called Compass Advocacy Network, or CAN, which we partnered with within the project. So I'll start talking you through then a little bit about the team structure. Quite significant, and certainly we felt that we benefited from a range of expertise. So within the core project team, led by Queen's University Belfast, there was ourselves, ARC and I, there was Compass Advocacy Network, or CAN, and another organisation called Praxis. But we also benefited from a critical friend, as we called it, or a delivery partner in each country, which included Ancraft Trust for England, Mencap Cymru, and Richmond Fellowship Scotland. Following the development of the research brief, then TILI proposed that peer researchers be recruited from the ARC's TILI broad group of 70 individuals and also the CAN network. But we benefited from 2 further individuals, both of whom had a learning disability, and they joined the formal advisory group. They were called Catherine and Jonathan. On the advisory group, we had significant experts, and they included Professor Jill Manthorpe, Joan Maughan, who's an independent chair of a safeguarding board, Professor John Williams, Joyce McKee from the Northern Ireland Health and Social Care Board, Anya Morrison, again a representative from Department of Health in Northern Ireland, and Agnes Lunny, a chief exec of a provider organisation. Tilly also stressed the importance of the wider reference group, really to act as a bit of a sense check as we developed and collated information. They also took the lead in developing the Easy Reads material. So as we said, peer researchers were at the heart of this project, and as a result we engaged in a formal application and interview process, and we're delighted to confirm Ursula, Leanne, Jadzia, Alex, Ethan and Joseph into post. Following that, quite an intensive training programme was developed and delivered by both Queen's University, CAN and ARC. And this really was to equip the peer researchers to co-deliver meaningfully all of the interviews across policymakers, providers, etc., which you'll learn about more. They also got a chance to do a wee bit of sightseeing in between as they visited various parts of the UK. And finally, in recognition that they undertook a job, peer researchers were also remunerated for their work. That's just a photograph of the peer researchers and Lorna, myself, Lou and Linda. This is the last slide that I'll feed in on, and it begins to describe the research process. 5 phases, and as I flagged, a year. So very, very fast pace intensive. We had to make sure that we kept on target. So phase 1 was really an analysis, a desk-based literature review in essence. That was undertaken by Lisa Marie Woods. Phase 2, which ran in parallel with phase 1, which we had to do to keep everything moving, was the recruitment and training programme, as I've described, to enable the peer researchers to undertake their role meaningfully. Phase 3 was semi-structured interviews with policymakers, policy advocates, politicians in each nation, which Lorna will describe. And phase 4 was around the identification and exploration of a case study which tried to highlight some best case examples from a provider organisation's perspective that specifically supports people with a learning disability to get their voices heard. And finally, phase 5 was an online survey completed with supporting organisations. Just to say, the project commenced in March 2019, and all 5 phases must have been completed by March 2020. I'll now hand over to Lorna.
Thank you, Leslie Ann. We have delivered our findings in a seminar in Wales, and my colleague Gavin Davidson, who's Professor of Social Work at Queen's, delivered that. So really this is just a summary. It's hard in this short space of time to capture everything. So I suppose I would direct you to either the executive summary or the full report, and we'll make sure that you get access to that. But this is really just an overview of our findings, and as I say, we're going to end this with some suggestion about how you might implement some of this in your own practice. As I said, that we conducted I think a thorough desktop exercise examining the consultation processes and outcomes across each of the 4 UK nations. So we collated all of the responses that required a freedom of information request from time to time, but we looked at all of the responses that were available for consultations around adult safeguarding legislation and associated legislation, because we appreciate that in some countries the legislation had been developed some years ago, so it was subsequent and related legislation and policy that we also looked at. So that was from both individuals with learning disabilities and organisations who supported them. I suppose it's fair to say that even though the processes were different in each of the jurisdictions. There was, I suppose, a surprising amount of similarity in terms of the issues that individuals and organisations raised. I don't think any of these are going to be surprising to you. Just a need for clarity around definitions. So, who is an adult at risk? What does risk look like? Where are the thresholds? There was discussion and concern about practical difficulties, particularly around organisations trying to implement safeguarding law and policy, often in an environment where they had limited resources. Issues around capacity and consent, and a suggestion that those needed to be given more weight in subsequent policy and legislation development. A strong suggestion across all four jurisdictions that there needed to be advocacy for service users who were involved in safeguarding referrals, and just the importance of negotiating between autonomy and rights. And I'm sure you appreciate that is an ongoing dilemma, but there was a suggestion that sometimes legislation and the following guidance could be either too inclusive or not inclusive enough. Okay, just to say that I suppose surprisingly to us, there were a limited number of organisations and individuals who actually responded in writing to consultations. This isn't to say that lots of people responded where there were formal consultation meetings, but the written responses were fairly limited. In our report, we look at exactly what was requested in the consultation and whether or not that was implemented in the subsequent legislation. It's hard to summarise that, except to say that there's a mixed picture. Many issues raised in consultation didn't appear to impact the final policy or legislation, but probably the majority. There were more which did, with significant changes made as a result of the consultation process. Okay, I'm going to move on now. As I say, I'm really just summarising or drawing out key points. The fuller findings can be found in the report. What about policymakers? So we interviewed policymakers in each of the four regions, sometimes politicians, sometimes policy advocates, and that could be people in senior roles in, for example, the Health and Social Care Board in Northern Ireland, who had a role of influencing policy. I'm just going to pick three kind of key findings from the policymaker interviews, and just to remind you that all of our interviews and data gathering was co-produced. So people with learning disability took the key role in conducting these interviews. Again, not surprisingly, hearing the voice of people with learning disability was seen to be an integral part for policymakers of shaping their views on how a policy or legislation should look, which is great. I mean, we did feel that there's a real commitment from policymakers of engaging with service users and their supporting organisations in this process. Again, not surprisingly, the best way to involve people with learning disability in policy making appeared to be through face-to-face conversations. And there was, throughout all of our data gathering, a very high value placed on personal stories and experiences. They were seen to humanise the legislation, making it real, making policymakers much more motivated to get it right. Policymakers did say that it was important that people with learning disabilities were prepared, that organisations had prepared them for the consultation process, particularly where it was face-to-face, and that their conversations would be high quality. They did also talk, I suppose, about not being over-prepared and allowing the individual to have a voice and not just to be representing the views of an agency. There was, I suppose, criticism or questions around timing of the consultations, and some concern that they were too late. I think I'm not in this presentation going to talk about each region, but my memory, and you can check it, is that the Welsh consultation process was excellent in that it took place at the beginning, middle and ending of a policy development process. But there were concerns that people were being asked for their views too late in the process. Policymakers did talk about that and say that it really was difficult because they wanted to ensure that they had something to consult on. So getting the balance there was really important. And policymakers also talked about using different forms of evidence, including previous policies and their evaluation, frontline practitioners' experience and empirical research. I hope you're following us. It's difficult to do this without any feedback, but just very quickly then, the policymakers identified a number of barriers to engaging with service users in developing policy. The social and political context could be a barrier. They were saying that you really cannot suggest anything in policy or legislation that isn't supported by public opinion and the culture of the time, and that was a strong factor in what legislation was ultimately produced. Policymakers said it was important for them not to suggest policy legislation that couldn't be supported. So if there wasn't the money to provide a particular action, then it was unlikely that that would make its way into the legislation. Competing interests were difficult, so that different organisations had different views, and it was difficult sometimes to find a way through all of that. Societal stigma and paternalistic attitudes to people with learning disability, so that it became more difficult to engage with them, and to there was some resistance to change in terms of stigma around people with learning disability. And I suppose, as you can imagine and know, policymaking often followed a scandal or a failure in the service and then became very reactive. Whilst our research is clearly around working with people who had learning disability, I hope that many of these findings and observations are relevant across a whole range of groups of people with different issues or disability or service needs. A second data gathering opportunity that we had was to work with an organisation in each of the 4 nations. Really, we identified 4 organisations that were seen to be successful in supporting their service users and in shaping policy. And we basically engaged with each of those organisations to ask them what worked, what is your guidance, what is best practice. And again, we don't have time to go into the detail of those, but they are highlighted in our report. I'm just going to take a few minutes to look at some kind of collective feedback from what worked. In terms of our data gathering, our peer researcher and researcher travelled to England, Scotland, Wales and in Northern Ireland and conducted focus groups and individual interviews, spending a few days with each of the organisations. You will see that there's kind of synergy, I suppose, in terms of the types of advice that the case studies were offering, which is not dissimilar to what the policymakers were saying. And I suppose, first of all, that whole sense of the absolute centrality of making use of personal stories and lived experiences of people with learning disabilities. And interestingly, respondents who had learning disability often themselves said they valued the opportunity to tell their stories. There had to be care taken around how their stories were presented, and lots of preparation and support in enabling people with learning disability to actually describe their own safeguarding experiences and the impact on them. There's also a key theme around collaborative working, the importance of all organisations working jointly with each other in terms of support organisations, but also with other professionals, maybe with academics, with service providers, and with governments. So the importance of networking. Where possible, and I appreciate this isn't always possible, but where there are issues of importance, trying to have a collective voice. So collaborations across organisations. A collective voice was also always seen as much stronger and had more impact than maybe individual organisations trying to present their own views. And the importance of establishing networks and relationships with politicians and policymakers in advance. So those were ongoing relationships and not just developed at times of policy development. Case study organisations talked about how well they used the media, and that seemed to be a really strong, important way of getting their voices heard. So developing networks and relationships with the media, making use of social media, public campaigns, online petitions. Campaigns were seen to both keep the issue visible, but also used as an opportunity to network and develop wider relationships. And I suppose, organisations did say, we asked them specifically, how useful did you feel it has been to respond to consultations? And they were saying, well, it depends almost entirely on the quality of information they get in the consultation, their timing of the consultation, and their ability and their own resources in enabling to respond to that consultation. Okay, I'm conscious of time, so I'm almost finished with the findings, and then Leslie-Ann's going to talk us through the action plan and ask you to think about how you might implement that in your own world. In addition to speaking with policymakers and in conducting in-depth case studies across successful organisations, we also wanted to get a view of the bigger picture. So we sent out an online survey using the ARC UK, their wider network. So it went to over 200 agencies or participants. That included delivery partners, commissioners, policymakers, and to a large extent, supporting organisations. And we asked those, I suppose, what's your attitude to consultations? How do you feel you're enabling or empowering your members to get their voice heard? What practices do you use? And how would you rate those experiences? Most organisations we surveyed said they did try to influence government policy. The forms of influencing included consultations, networking with other organisations, and providing training. Again, not surprisingly, the forms of evidence seen as most useful were personal testimonies and case studies, where they would present actual safeguarding issues and how they were managed. About 80% of the organisations who responded said that they viewed or thought that their policy attempts were successful to some degree. Not sure that that was quantified in terms of how they were successful, it's more of a perception. So I'm just going to summarise our findings quickly here, and then we'll move on to the action plan. It was interesting, there was a high level of consistency across the different sources of data. In terms of the formal consultation processes, as I've said, there's a mixed picture. So many of the issues that were raised, at least in writing, didn't appear to impact the final policy, but probably more did. And there were significant changes, and you can look at those in detail if you want in the report. Overarching feedback from the policymakers was that they were interested. They saw service user voice as a vital part of the process. They talked about the strengths and challenges of engaging people with learning disability, the need for high quality evidence provided by respondents with real life experiences, and the challenges that in a sense, even though they were motivated, their hands were tied by a whole range of other factors. Case studies highlighted the importance of using people's personal stories and lived experiences, including looking at how legislation did actually impact, so existing legislation, how it did impact individuals on the ground, and the importance of collaboration. And I've said already, I'm not going to repeat what I've just said about online survey. The next two slides, I know we've only about 10 minutes left, so I'm not really going to say anything about these. I think they're summary, but they're a summary of enablers to getting our voices heard, which were consistent across the data gathering sources, and barriers. So we're going to conclude our discussion now. Leslie Ann's going to take you through what our action plan. We developed action plans with policymakers and with support organisations in each of the 4 regions. So we had a generic action plan and we geared that to specific regions. And as I say, we're just going to be talking about the generic one now, but you can look at the Welsh one in more detail.
So last couple of slides. The next 2 really, you can read for yourselves, but there were 10 particular actions that were identified that could maybe benefit policymakers in their role and responsibility. And it ranged in a number of ways from, for example, a particular spokesperson, a commissioner, representing learning disabilities, but it also included areas such as outreach teams, because there was the recognition that, you know, it's important actually to get out to the ground, and sometimes formal consultation is actually a bit late. It's much better getting some of the views off the ground to then shape what it is you're consulting on. It went on to talk about training and the constant need for reviewing and evaluating existing policies, and of course the importance of all stakeholders' involvement within that. And then moved on to recognising that even the issue of really safeguarding, but also building the capacity on an ongoing basis of people with a learning disability to engage in policy shaping and making is a real tough thing. So really some sort of marketing strategy would be particularly useful there. And of course then accessibility is always high on the agenda, and hence reasonable adjustments, including easy reads, are of critical importance, not least with realistic timeframes, because to ask people to meaningfully contribute, they need to have time. So there's some of the things that we, I suppose, identified may benefit policymakers. But now I wish to specifically focus on organisations that support people with learning disabilities day in, day out. I don't know about you, but constantly, whenever there's a bit of a political debate about an issue, I have heard on multiple occasions, you know, how stronger together, the need for a collective voice. And some of the things that as provider organisations we are constantly challenged with is the resource. However, what we found through this research is that as individual organisations, we really need to think about how we can integrate networking and so on and collaboration into our day-to-day business. And of course, certainly from my own point of view, a research and policy officer would be an absolute dream to have. We can't afford one at the minute, but it doesn't mean that we shouldn't be looking at thinking about how we could on a longer term basis, or indeed utilising some of our partners' research and policy officer posts through better collaboration. Secondly, the second action is around outreach programmes, and one of the things that it certainly sprung to mind here is, again, Frequently I hear, whenever it suits certain agendas, you know, same old faces in the room, same old mantra. So to challenge that, I suppose the onus is on all of us, that we need to think about hard to reach. We need to think about the people with learning disabilities that are currently not in receipt of services, maybe living at home with an ageing mum and dad, and actually aren't known to our statutory partners as of yet, because their views matter too, but also some of our individuals who live rural. Again, hard to reach. We need to think about creative ways. The next bit really is around a reminder for all of us that regardless of our job title, that our daily responsibility when supporting people with a learning disability is to develop and enable their self-capacity to advocate. And the more that we have this and give them day-to-day experience of making choices and influencing the shape of their own lives, will probably indirectly increase their interest, understanding, and desire to influence broader, right up through to the policy making framework in the country context. Recommendation 4 is, I suppose, a little bit about reasonable adjustments again, but certainly what I would say is, for all of us, understanding our policy making processes can be really, really difficult. But to meaningfully contribute, it's important that actually people with a learning disability are supported to grow their understanding. And for me, this links very clearly and inextricably with recommendation 5, or the action plan 5, which is saying, and this takes time, and to build in reasonable adjustments. And hence that goes back to really our daily ways of working. Having worked in a number of organisations, particularly charitable, and working with a number of expertise in terms of maybe fundraising, we all know that there is nothing more powerfully or potentially influential, such as personal stories. We can, as individuals, relate to these much better. I suppose what struck me within this point 6 of the action plan was experts by experience can bring real life to words on paper. So it's on all of us to try and get personal stories better represented to then shape an influence going forward. Action point number 7 for me neatly describes what we decided to try and undertake with this research, and so it's saying we need more of this, and of course this was funded by DRIL. Evidence is hard to argue with, and when you have a range of expertise in the room, from academics through to provider organisations, and most importantly experts by experience, really it does enable shaping and influencing the future. So that collaborative and participatory research is critical going forward. And then action 8 is really recognising that people with a learning disability need reasonable adjustments in terms of easy read and accessibility to empower them with proper information. But similarly, when we're talking to maybe our policymakers, we might need to think about how we help them understand it from a different lens, from a different perspective. So tailoring the information is really important, understanding the limitations and the responsibilities of everybody's role is really important, because then that way we can think about how we want to message what it is we want to say. Active involvement is action point number 9, and obviously the onus is on organisations to think about frequently how we can embed this in our daily practice again. And finally, number 10 is really about building the capacity of people with a learning disability to, as I would say, have a meaningful life and have equal opportunity access to influencing any element of life that they wish. But particularly when we think about policy making, we need to think about maybe some adaptations specific to that. So they're the 10 points identified as a result of the research.
Okay, folks, that's us finished. So thank you. I mean, we appreciate the chance to share this research. We just finished in March. So you'll know what that means. I suppose we had a whole range of activities organised which have been cancelled because of the COVID outbreak. We really hope the research doesn't get lost but I suppose in terms of dissemination and following that through, making sure that there is impact, I think that's, I suppose, paused at the moment. But thank you for the chance of sharing it, and we wish you all the best with your seminar series. Thank you.